Welcome to the Opportunity Knocks podcast by Empower Purpose, hosted by me, Michelle Valenzuela Wolf. Every week, we feature different extraordinary female entrepreneurs in the business and wellness segments on just that, opportunities. These segments deep dive into how these courageous women transition into their purpose. We want to give you permission to discover, pursue, and achieve your goals. We learn and reaffirm that life is never linear. It's how we as women choose to take, make, create, and evaluate opportunities. Remember, it's all gonna be okay. Thank you for your support and make sure to subscribe. Hey, Dr. Naina, how are you?
Good, Michelle. It's nice to be here.
Yeah, I first of all want to thank Cameron and Mary Beth Brumon for the introduction. And, it's one thing to make an introduction, as we know, but then to follow up with the introduction and have this amazing interaction with you the first time we talked. I felt so connected to you. I just was really grateful because you never know. When we really look at who you are, I like to think of you as not only just an out of the box thinker, but really a pioneer in the wellness space and in longevity. The more we talked on the phone, I was like, who doesn't this lady know? Literally. From celebrities to everyday people, it's honestly refreshing to be around someone in our day and age, on social media, you don't really know who to trust and who not to trust. But I would say there was at least 10 people that were like, you need to talk to Dr. Naina. She's amazing.
Thank you. Thank you. I think that stems from the fact that as you have probably experienced in your career, that if you're very passionate about what you do and you take that, so to speak, that work very, very seriously, where you put dedication and just pure, it's just pure passion that
Mhm.
has led me to where I am now for this quest for, for medicine initially, and now for longevity, for regenerative medicine, nutrigenomic medicine. These are terms people just don't talk about
Yeah.
as readily. Yeah.
And when did your journey start? Like, tell me about how you got started. And I mean, clearly
I
you've been
think,
in the field for a long time, but like, how did
yeah,
it start?
I think I wanted to be a doctor ever since I was 6 years old. So that was just, I always wanted to be one. But as I progressed, I realized that my father was a very famous mathematician, and
Mm,
he wanted me to be a mathematician.
interesting.
And so he always stressed that where everybody got to go out and play on Saturdays, I got to sit and listen to these distributions. And he was a statistician, and so even though I hated it, but I learned.
Did it serve you now? Like when you look back on
Very
like,
much so, very much
interesting.
so. Because he would tell me one thing. He said, you never, statistics is where you just take a look at one vertical and you ignore so many of the other things. And he said that the distribution, so many of the studies, and so many of the way that people use these distributions are incorrect.
Mm,
And he would literally laugh and say, hey, I could relate X to Y in any realm.
mm,
And I could come up with a proper distribution. I could come up with whatever, and I could relate it. But
mm.
people forget, and that kind of sunk in my mind because as I went into the allopathic medicine realm, and I went on, I had a couple of years of surgery, and I graduated from medical school. And my quest was to become a plastic surgeon, and then I had three children along the way. So
Yep.
I switched careers into internal medicine and longevity. And I still felt that there were so many studies I would read, and that would always enter my mind, and I would question. And that got me starting thinking about then really going back into my biochemistry book rather than looking at the statistical significance
Mm.
of certain things.
Almost in the way where it's like, math, as people always say, the one thing that you can count on is that the numbers don't lie. But in fact, actually, when we're talking about stats,
Statistics.
yeah,
You
statistically,
can't,
we can massage numbers.
it's how marketing is. I
Exactly.
make the analogy of stats to marketing.
That
If
because
you have
that's
the right
the
marketing
only
machine,
stats class you take.
if you have the right marketing machine, you can make anything look amazing and any product looked amazing. And same thing with stats. If you just pick the right hypotheses and you pick your parameters, you can fly with them.
Yeah, so that's beautiful because it actually played right into this idea of non-linear thinking.
Yes.
Mm,
So
yeah.
now we get into, right, when we get into medicine,
Hmm.
and as I entered and I saw my clients that were chronically ill, and I start to play a game with myself. I was seeing up to 40 patients a day, and I hardly had 5, 10 minutes to see them and to make a difference. And I was always interested in this field called nutrigenomic medicine. Now, that was another parallel to my math. I went on to get a master's in math because I think my father really encouraged me, and I was good at it.
Yeah,
It was something a no-brainer. I literally would ace classes and
must be nice.
I did my master's in like I think a year and a half or whatever. Yeah.
Wow.
So it was a very came very easy to me. But I make that analogy because in medicine, in allopathic medicine, we entered a realm of two dimensions.
Mm-hmm.
Okay. I'm going to give you an example.
Wait, I
Okay.
want to have one question before you say that.
Yes.
Define what allopathic medicine is, because that's what people used to say all the time about
Yes.
20 years ago,
Yes.
20 years ago.
Yes. Yes. Allopathic medicine is that we studied traditional physiology, biochemistry, certain principles. We looked at studies and we really start to relying on studies,
Hmm.
perhaps about a drug.
Got
And
it.
we really geared towards a diagnosing a person, not in the gray zone. It
Mm,
had to be a disease or a
mm,
disorder.
mm, mhm,
And then there was a treatment. And the treatment would be a drug or a specific series of procedures if anatomical issues were involved. And that's kind of how allopathic medicine was sort of linear in that you had to come up with you had to have a diagnosis.
mhm,
You had to have a disease, a
mhm,
disorder,
mhm,
and then there was a treatment modality. There were certain instances where we can go off label and off stem, but there is a sort of a cult following of standard of care.
mm,
What is, let's say if somebody gets pneumonia and it's this bacteria, you have to give this drug.
mhm,
There's a certain standard of care involved.
mm.
And that's how medicine flourished and
How
has
it
flourished
evolved.
in allopathic medicine.
Mhm. And so, do you think that that contributed to this concept? I mean, everything became standardized. Like you said, there was a
Yes.
standard. Like we see somebody for 10 minutes, like you said, I had 10 minutes with the patient to make a difference. And that's how, like, basically the drug industries also started to flourish too, because we were basically prescribing medication more instead of treating the actual root cause.
Yeah. And it's not so much the drug, but it's also people. People
Hmm.
were being educated in a quick fix.
Hmm.
There was nothing about lifestyle. There was nothing about epigenetics. There
Hmm.
was nothing about your, daily, eating. As you see, even the pyramid, food pyramid is reversed,
Exactly.
right? Right.
Yeah,
So we
totally.
didn't even know. So in other words, that was not part of the doctor's realm. It was really, it was yes, the drugs, and then we just somehow had to rely the patients. They wanted a quick fix.
Hmm.
So it was, if somebody who wants a quick fix, not willing to make a lifestyle change, absolutely, I'm going to actually go more into the allopathic realm
Hmm.
because, for example,
Yeah.
let's say you've got borderline cholesterol.
Yep.
Okay. And you come in and you say, look, I've got a borderline, how come I have this high cholesterol? And what do I need to do? Now, I could spend 45 minutes to an hour, and my clients know what I do. The time and the best gift you can give anyone is your time.
Right.
So,
True.
so if I give the time and I discuss, let's say, lifestyle, I discuss nutrigenomic medicine, I discuss epigenetics, things that most people have never heard of. I'm
Exactly.
like talking like
Yes.
foreign right now
Yes.
to most people. And and then if that person wants a quick fix and says, look, I don't want to know any about that. Just get my cholesterol down, and that 100% I'm going to give them a statin drug.
Hmm. Exactly.
So there's absolutely a place for the pharma and for
Absolutely.
the drugs because it's a two-way interaction. And what is the quickest way to do it in medicine is to get a quick diagnosis on you, get a disease diagnosed or a disorder, or and then we give the treatment, which is a standard of care treatment, which
Yes.
makes sense because that's how it kind of has been.
So
Now,
when you talk about epigenetics and that route, that's different. What I love about you is that you treat the whole person, not the
yes,
symptom.
yes,
And you try to find, you're like relentless at trying to find the root cause of why something's not functioning
yeah.
properly.
So I'll give you an example. Let's take that same person who had the cholesterol. Now they come to me and they say, okay, what if I just don't give me 6 months and I don't want to go on a statin drug? What else can I do? I'm willing to make the effort. Okay.
Hmm.
That changes the game. So the way that game changes is that, okay, what is the starting point for all your hormones?
Hmm.
Cholesterol.
Hmm.
So is it not perhaps logical? And this is without any science, right? We even
Yeah.
telling you. But logically, if there was a biochemistry fact that says cholesterol is a starting point for all your hormones, they're declining. A woman is losing zero point 0.4 pounds of muscle mass a year past the age of 40, and hormones are declining, then maybe it not be a natural thing that the cholesterol will start to go up. That's
Yeah.
number one. Number two, maybe there is what we've, and this is a very exciting thing for 2026, at least in my clinic. There is something known as cortisol dysregulation peripherally, but
Wow.
there's also cortisol dysregulation within the liver.
Oh, wow.
So when
Interesting.
we go into this cortisol dysregulation and the stress and so forth, maybe that would increase the cholesterol.
Hmm.
So now we're finding maybe just diet
A lot
alone.
of times they're not even looking at the liver, by the
So
way.
that
Yeah.
exactly. And
Hmm.
maybe just diet alone.
Hmm.
And maybe it could be a thyroid condition, a subclinical where you're not really presenting. It's not like, by the time we now diagnose disease, even our first graders are so smart that they can do it. So we're falling into the gray zone. And
Hmm.
that's where you have exploded, I've exploded, longevity has exploded, wellness has exploded, and the
Absolutely.
CAGR is growing by leaps and bounds because the gray zone is becoming so apparent.
Mm.
People are feeling things there's no explanations for,
Hmm.
at least in the allopathic medicine, because we can't put a disease, but there's a symptom.
Hmm. Exactly. And what do
So
you think is like bringing the awareness to the symptom for people? Is it the stress or like it's like they can't hide from it
they
or
can't
they're
hide
just
from it.
becoming more
They
aware?
can't hide from it. It involves, I mean, for example, if you have someone so fatigued
Hmm.
that they're not being able to get up in the morning and then they kind of sneak in, okay, I'll take my cup of coffee, and then they get that afternoon fatigue, okay, I'll take another cup of coffee or energy shot, or I'll take a sugar fix, right? They discover little fixes.
Hmm.
But
Totally.
then when when
Band-Aid.
when it's getting so bad that it's starting to interfere in just every aspect of their life, they're going to come in and let's say the entire workup is normal.
Hmm.
The allopathic workup is
Hmm.
normal.
Hmm.
What do? You tell them, hey, you know what? It must be you're depressed. So maybe we'll put you on it, right? Are
Yeah.
you depressed? Go for a psych evaluation, or let's go and exercise more. Go to the gym and just see if that will. So
Yes.
now we're just kind of like
We're grabbing
trying
for
to
different things and
grabbing.
we're
There's no beautiful cohesiveness. There's no understanding of that human being. There's no what I call a beautiful story to that person where we can say, ah, I know exactly where this happened and biochemically this happened and this is going on and let's fix that.
how do you bring it into a whole conversation? When someone,
So
we're in a microwave society, everybody wants everything
yeah,
fast, like you said. So you're going
yeah.
to sometimes have to, or not have to, but you're going to sometimes suggest that they go on the medication. Where do you start? Like besides blood work, is that like a listening thing? Is that a
It's a
behavioral
listening
thing?
thing. The
Mm,
doc, I
mm,
start with their story.
mm,
I might spend 2 hours, an hour, 3 hours. It doesn't matter. I need to understand their story.
mm,
And then now I can look at the blood work,
mhm.
or I can look at some of the blood work that at least that I like to get on an individual with that story. And or I just sometimes look at blood work and I see if I see, for example, a low serum ferritin, a low vitamin D level. I see low progesterone in a woman, all that, and I say, and I see five or other parameters. I say, look, you've had trauma in the past. You got to tell me, and it
Mhm.
comes out.
Interesting.
Or
Wow.
or if I see XYZ symptom and I'll say, wait a minute, I need to just this is this is a thyroid talking. So then I go looking at special biomarkers and I prove it.
But is that wisdom or is that curiosity or is that, I
I,
mean, because the word that you kept saying just now is see. I see. So it is it's a gift to see, right? And so when we're talking about traditional doctors and medicine, many times they don't stop to hear the story or to see.
I think it becomes you have to get when you get the story, you have to get yourself inside right there with that energy with that
Mhm.
client. I'm
Mm,
like I'm right there with them. I want to see what they felt, what they
mhm,
are feeling.
mhm,
And when I start to see their symptoms and they describe all the things that have happened in their lifetime and then now what's happened, I can predict sometimes even the labs when I just
wow,
start to see the story.
that's crazy.
And I'll tell my clients that sometimes. Yeah,
Mhm.
I will.
So really like you hold your clients in like a space to truly heal, like why you became a doctor, right? You wanted to be a doctor at 6 and you became a doctor because you wanted to help people heal and you're still
Honestly,
in that.
honestly, I never thought I would ever be doing this.
Mm,
I was in surgery. I was going to be, I mean, I was doing trauma. I was doing, Dr. Krizik was my mentor at the Chicago. We were in the burn unit, and he was the
wow.
one of the physicians who bought in the 80s. Okay, I've been a doctor a long time.
Yeah.
So he bought a hyperbaric unit
Oh,
for burn
gee. Oh,
victims, and
wow.
he says,
Interesting.
okay, doctor, now you're going to have to show that this is helpful. And like, and I did all this research. And at that time, we couldn't even measure like, we were just in the 80s learning about mass spectrometry to measure like free radicals and all. And I
Mhm.
kind of said to him, I don't think it's that good of an idea for burn victims. It's
Wow.
great for like chronic,
Chronic
chronic like
pain.
wounds and things
Yeah.
because it creates more oxidative stress. And so that's the environment I was in. But yes, there was a part of me I
Mhm.
like why did he take me? Why did he take me as a protege? And why? Because when he interviewed me, I was talking about free radicals at that time, and I was like, my 20s. I was like early at 20 years in college. I did a whole paper on free radicals and how to neutralize free radicals,
Wow. That's
and
crazy.
and my professor kept my paper.
Wow.
So there was, yes, there was something in me that since the age of 20 that wanted me to gravitate. And I did attend nutrigenomic conferences where like a bearded biochemist would show up. And
Mhm.
now that whole field exploded. Yeah.
I'm curious to understand, like, where did longevity start, right? So we have
Um,
this, like, epigenetics,
yeah.
and then,
Yeah.
this whole conversation about wellness being a $5 trillion business. And I mean, honestly, there's so many silos between it. But like,
Yes.
if someone is into traditional medicine and they are suddenly hearing, like, oh gosh, longevity, longevity, longevity. And I
Yeah.
feel like what's happening now is because peptides are available to all of us, and I feel like people are just ordering them off websites and they don't even know where they're
They
coming.
don't even, yeah. It's wellness has become I think we're getting also the way allopathic medicine, and we chose a lot of people stepped aside and said, this is not for me. And I think wellness is going to have to evolve
Mm,
into a more mature field
mhm,
because what we did as anti-aging, we were quacks back in
mhm.
2000 when we started, and we thought growth hormone was the answer to everything. Okay.
Yeah.
But what helped us as physicians was we trained in functional medicine. We
Mm,
started to see what are the biochemical imbalances. So
mhm,
right away, I would like to say, look for, I think, having someone with functional medicine background, okay,
mhm,
is very important. However, in my training, and I trained with my mentor was Dr. Jeffrey Bland. He's written the book Genetic Nutritioneering. I urge all my clients to read that. But he taught me the beautiful part about how the root causes immune dysfunction,
mhm.
mitochondrial dysfunction, neurotransmitter imbalances. These are things people don't, again, normally think of, right?
Yep.
So he was good, but there was another piece missing. In functional medicine, yes, that was good, but we needed to understand and that's why I love the anti-aging
Yes.
and the whole thing that was started with
Yeah.
A4M and anti-aging and so forth, because it focused us back on hormones.
Mhm.
Functional medicine was first fix the gut and all of it. It's very important. But now I also gravitated towards the hormone. And then that led me on my own journey of reading about receptors every single day to
Mhm.
this day.
Mm.
And it was a
And what do you mean by
combination of those.
receptors?
Everything is about receptors, lock and key in terms of hormones.
Totally.
And what we are not realizing is when you do too much of even a medication, of even too much of a hormone, you can downregulate those receptors. And when you don't have enough, you upregulate. So it's kind of the same thing. And
Trying to find the balance.
side effects start to happen in
Mm.
both when you're deficient and when you're overdoing something.
Mm.
So it's all about receptor physiology. And this has led me now into getting clients that I'm not a psychiatrist, but is now getting into just by looking at receptor, we can figure out, well, maybe this person might not react if that dose is increased and so forth. And then it gets into even more our physiology of our liver. How
Mm.
do the toxins as a body, as you introduce toxins, how
Mhm.
do we clear them? We may have what we call SNPs, single nucleotide polymorphisms. So our phase one, phase two detoxification pathways may be very different. Yours may be
Exactly.
different, mine may be different, and another person's may be different because we've got these individual SNPs where these enzymes don't work. And
Mhm.
a perfect example of that is impaired methylation.
Mm.
Now it's being talked about. Now with Gary Brecka and so many people, we knew about that 15, 20 years ago.
What does that help with?
So impaired methylation is basically when you have a gene
Hmm.
that does not break down folic acid
Oh.
into what is your bioavailable.
Mm.
So in order for you to utilize that folic acid, you have to have this enzyme called MTHFR,
Yep.
methyltetrahydrofolic acid reductase enzyme, and that breaks it down to 5-methyl and 5-formal. Now,
Okay.
this can be utilized by the body. Now, suppose that person has this impaired methylation and cannot break it down. Then the body builds up folic acid, becomes actually oxidized,
Hmm.
adds to the inflammation, free radical, all of that. And in children, especially, their moods they could be just going off.
Mm.
And the teacher could be thinking they're ADHD or they're like manic or they're like something's going on, they're
Yes.
bipolar, when it could be because we fortify everything with folic acid.
Hmm.
And as you know, there's a push even now in California with Governor Newsom that everything needs to be fortified with folic acid.
Yes.
Well, with this awareness of impaired methylation, how can we justify that?
Mm.
So again, this is just one
Yeah, this is
of
one area.
hundreds of things that we don't know, and we need to teach the public about.
So, like when somebody comes to you, okay, because you have a clinic in Beverly Hills, what is the main thing people come to you for?
Main thing people
And
will
I know
come.
that you treat every
There's been a
patient.
shift. Yes, there's a
Yeah.
shift. Initially, it was all hormones, very, very like women with menopause,
Mm.
and they're just not getting better. Or now there's been a shift with women that are because a lot of the are being treated with a patch and
Yeah.
an oral.
Mm.
So, and again, that can get into certain people don't do well with that.
Mm. I know.
So I'm seeing now a shift of those women coming to me for and men. They're using a lot of bodybuilders, a lot of males that have been doing testosterone high dosing,
Time.
that is now suddenly their sex drive is down and they're tired. How is that possible? So
Hmm.
we get into that whole biochemistry. But right parallel to this is autoimmune.
Hmm.
I have never seen in my
An
lifetime
epidemic with
the
autoimmune.
rise of epidemic where we had the epidemic diabetes. We
Mm.
had epidemic people with cholesterol issues. We had now what I'm seeing is autoimmune.
Is that stress?
I think it is a
I feel like we put
combination.
everything underneath there.
I think it's more than stress because we're putting that into that umbrella, but I think it's hormonal decline, it's mitochondrial dysfunction, it's toxin exposure,
Mhm.
it's neuroinflammation of the brain, certain and sometimes and I again don't take me wrong, but it's sometimes certain people can't tolerate a whole bunch of vaccines at the same time.
Yeah, totally.
Okay.
Mhm.
There's got to be a checklist. And that's kind of what got me, years ago, kind of out of the box thinking. Obviously, we're more vulnerable to attacks when we even talk about these small things, because people just want to pick up in 30 seconds what you're all about.
Exactly.
And I refuse to go into that box. So,
Well, and it's true because I mean, part of the reason why, it's like longevity is a long game. It's not, it is a game of, it's not unlike personal growth, by the
that's
way.
right.
It's just
We
dealing with your body.
not
Yeah.
and we look at aging. So that's similar to aging when we say longevity. And so then we want to say, okay, what are the theories? What are the basic theories of aging? And so when we explore now, multi-billion dollars have been made on the free radical antioxidant theory of aging.
Yes, for sure.
Okay. And there's been money now made on the telomeres with the telomeres lengthening. A lot of money being made in that area. Then there's now the newest thing, which I was doing 15 years ago, but I gave a lecture in 2000. It was in Goa, Dr. Lenny DaCosta in his conference, mitochondrial biogenesis, how to make new mitochondria. And I gave that, I believe, in 2011 or
Wow.
we're talking a long time ago. So I've
Yeah.
been in this game a long time. And so now that the multi-billion dollar industry is going to be mitochondrial dysfunction.
Mm,
And then there is obviously the DNA with the DNA mutation. And so there's different, I can go on and so there are about 6 or 7 theories of
hmm
aging.
mm.
And each one, there's still 2 or 3 that have gone unnoticed and under the radar,
So
which
do
will,
people come to you for anti-aging solutions?
some
And
will come.
then, I mean, because I know that you're obviously into that kind of thing as well. And then when they come to you for the anti-aging solutions, are you then sometimes referring them on to like other physicians?
So if they come for anti-aging solutions, I first look at their biochemical imbalances. First, you have to beauty is from the inside out.
Mm,
So
gotcha.
we first figure out their biochemical imbalances, and then we progress to I do all the aesthetics with my surgical experience. Obviously, I do the fillers, I do the Botox, all this, and the lasers and so forth. But I've learned in my journey, you can have one laser, 2 lasers, and all of that. And when I was giving a lecture on a laser, it was a radio frequency, multipolar radio frequency, and one of the doctors in the audience asked me, "And how long does this last?" And I felt the need to educate not only the medical industry but also the consumer, the client industry, because how do I know how much more inflammation you're going to do, how much your
Exactly.
cortisol is going to go up? When your cortisol goes up, your collagen starts to break down. We have
Interesting.
collagenase, which is an
Wow.
enzyme which breaks down collagen, has been known to increase when you have cortisol.
Wow.
And when I was the Olay ambassador to Procter and Gamble, I was the Olay ambassador to represent their Olay regenerative line back in 2008, right?
Yeah.
And when I got my contract with them, we started that Inside Out Beauty campaign. These are the things we talked about: beauty from the inside out, stress. How does stress age you? So when you see a treatment, and one woman has a treatment and she does great initially the first 6 months, and then suddenly her skin or jowls are, you don't know what inflammation, what her diet has been, what her hormone levels are, what her biomarkers are. What, you see
Yep.
where I'm going with this?
Yep.
And now you're asking me how many treatments and I'll notice a result. And I have no idea about your lifestyle, about your biochemistry. So that's why we're looking for this quick fix on the outside, but it's not going to last.
Mm-hmm.
And that's why longevity, it's starting to be emerging because
Yeah.
we're starting to question, is it just getting a facelift? Is it just getting a laser? Is it just getting Botox?
Mm-hmm. No.
And what are we even finding about Botox? Because when you paralyze one muscle, what does the opposing muscle do? It becomes stronger.
Mm-hmm.
So that opposing muscle, now when you frown, you've got opposing muscles coming in.
Yes.
Now you're going to need more Botox. So is that what we just eventually go to? Botox fillers and then facelifts?
No.
What's happening on the inside?
Yes.
Longevity is, we're energy. We
Mm-hmm.
are dynamic human beings.
Mm-hmm.
We're multidimensional now.
Yes.
And we're stuck in a model of allopathic medicine, which is linear. and two-dimensional.
The other thing about longevity is that it is cost money. And in general, good doctors often are concierge doctors. So then how do we help the industry catch up to understand the importance of not being two-dimensional?
I think it's not only that, I think even in you asked me two questions. You said in terms of longevity, I think it is inappropriate. We're still teaching things that are inappropriate, even in longevity.
Mm,
So because we're seeing the dollar sign, unfortunately,
mhm,
and the marketing angle of it. And I say that because it's just not one laser that's going to be your answer. Again, let me give an example on this, okay? Let's say it's just biochemistry. See, maybe it's the passion that I speak with, but let's say, and I spoke
I
this, I
love
give
it.
again a lecture. We remember Cool Sculpt. You've heard of Cool
Yes. Oh,
Sculpt.
yeah.
So Cool Sculpt causes necrosis of fat cells, right?
Mm,
So if it causes necrosis of fat cells, that means you have a quick release of toxins. Well, the toxins are going to go redistribute
mm,
because the fat cells protect them. So what are you doing to that person? You don't know what their toxic burden is. You don't know if releasing that could maybe increase their risk of
possibly
cancer.
help.
Do you
Yeah.
see what I mean? So again, you're all you want to do, and all that person was looking to do is just, I'm going to try to get rid of some fat in my belly.
Yes.
But then what have you done? And so is that really a longevity treatment? Is
Mm,
that really a wellness treatment?
mhm,
So it's all in context, I think.
mhm.
And I think we're still thinking we need to really shift our thinking into biochemistry, into what are the biochemical imbalances, and then have a beautiful protocol for that person. Even beauty treatments can be defined on that basis.
Having a protocol and sticking to a protocol, similar to like you mentioned vaccines, right? So, like when your kids are little, sometimes doctors are encouraging you to follow like a plan. I didn't follow that exact plan. I waited a little longer to do different things. That's
Yeah.
controversial, as we know. However, I would say that I think that what happens a lot of times, if we just take beauty, for example, or even like getting on a peptide or a
Yes.
GLP, nobody's monitoring anybody.
Nobody. And for example, let's say that person had kidney growth, but kidney cancer and kidney even benign tumors are very. And let's say you do BPC 157, you could promote that.
Mm,
So again, now they're trying to stack these peptides. It's if you do understood the biochemistry, one negates the other. And then what are peptides? They're amino acids.
mhm.
They're chains of amino acids. And each subunit has a certain activity. So if you start to stack improperly or in that particular person, it may not be the right thing.
So, what do you recommend? Because I swear to you, like for example, a friend of mine, I was just looking trying to look for something. A friend of mine wrote me yesterday say, I'm no longer doing Botox. I'm going to do uh GH, what is it called? It's for skin. It's
A
for
GHK copper
yes,
peptide. It's copper
exactly.
peptide 1. It's
Yeah.
GHKCU. Yeah.
Yes. And she's like, you should get on that. And I said, I mean, what's in it? I mean, my first question was, before I purchase this, what's in it?
Yeah.
Because I'm obviously having to put something in my body in order to get the result. And what makes this better than me using collagen? And
Right.
of course, then we go into like which collagen works, right?
Right.
Um,
Right.
and then there's genetics, like just in general, like some people have more elasticity in their skin than others. But again, I just go back to it's all very overwhelming when we're talking about our health.
Absolutely.
So I feel that the you're providing a service that is beyond the traditional way of looking at things, an out of the box thinker to help really solve problems.
And to achieve true beauty.
Yeah,
Because when
from
you
the inside
when
out.
you start to, yeah, because when you balance, now what we do is we first do your basic 101. You can't go to a peptide if your basic 101 is not balanced.
Hmm.
If you're producing inflammation, free radicals, and you're having hormonal decline issues, and you're having all of this, you're having all this stuff happening, and then you want to try to do a peptide to put out a little fire. It doesn't, it's not going to work.
Yeah.
So you build a foundation, basic 101, and then you layer it. Then you say, okay, I'm going to go maybe go get a facelift, maybe for or I've got a superficial something going on. Maybe copper peptide one might be better. Maybe you got some other thing going on. Maybe then you pick the particular peptide.
Hmm.
Then you have to have a proper protocol for hormones. You have a proper protocol given to you for even your nutraceuticals, nutrients. You can't take how many nutrients are we going to take, right? There's about I think at least 100,000 nutrients out there
Hmm. Wow.
and so many brands. It's true.
Yeah.
And so, how are we going to fit into that? So, again, that's where my passion came in. I, again, go back to that story when I saw 40 patients. I wanted to learn nutrigenomics. So, I used to have these nutraceuticals. If somebody had, remember, I said, okay, I want you to try this. And then I would hear back always. They would follow up with me. And I got so good in 5 minutes trying to figure out what might be good. But I was very blessed because I could see the labs come back. Oh, HSSCRP went down after I told him to do this in 6 weeks, because I could do that labs and see and
Yes.
follow. So I just learned associations, what imbalances and what nutrients we can use to fix that, and what hormones can fix this thing and how to do it and so forth. So it just kind of grew.
So let me ask you a question about this. So all of these wellness clinics and longevity clinics, and whether it be Restore or Next Health, or I mean, there's so many. You've been asked several times to be involved in many of these different.
Many, absolutely. All the time
You
I've
said
been
something
asked.
really poignant to me the other day, because I was telling you the doctor that my doctor was retiring, and you said, you know, a lot of these companies that come around, they don't show longevity themselves. They basically are
They're
bought.
venture capitalists
Yes, they're bought
buying
by
out the practices. I've gotten
companies.
an offer. I
Yes.
mean, I get offers. I can put in 5 clinics today,
Hmm.
but I would give up my freedom to be
Hmm.
able to really do what I need to do.
Hmm. As in take care of
Again, again, it's
patients.
again, you have to wear, because the moment you, like, for example, if I was to sell
Mhm.
something,
Yeah.
right? Then this has been a discussion for many years. When I stopped being the only ambassador, I had so much, many opportunities. The first offer that comes is, oh, scalability. How are we going to scale you,
Exactly.
Dr. Naina? How are
Exactly.
we going to do that? I don't want to get scaled. But with AI, yes, we can go down that flow. We can create the story. We can get that story. We can now put into how that flow can go, and what are the key questions to ask in the history, what are the biomarkers based on that history, what are the beautiful treatments based on what 20, 30 years of experience. Yes,
Mhm.
those are the things that we can, but it has to be done correctly,
Exactly.
and it's got to be built layer by layer. You can't just say impaired methylation is your one vertical and you're going to get healthy. You can't say plasma exchange. Oh, go get your blood taken out and we'll shoot blue light, this light, and look, everybody gets better. Have we really followed those people? What do you mean by better? Have we followed those people like 20, 30 years? How come stem cells were being given and people were going to Switzerland, all the celebrities from Philippines and
Yeah.
so forth, and everyone goes there, and why don't they look as good as they should?
Yeah.
And why are they not as healthy as they should after being exposed to all the stem cell treatments? Now we're pushing stem cells. Think
Mm.
about this. Stem cells from somebody else still has immunogenicity. Just remember that.
Yeah. Well,
So you have to be just careful, because even a mother, when she gives birth, that DNA is imprinted. Just so
exactly.
I'm just saying, for
I
that
know it's
particular
really
moment,
interesting because
for a
people don't.
life-threatening, yeah, for
Yep.
a life-threatening situation, a stem cell treatment maybe, and those are the testimonials. Marketing is going to push on that. But
Mhm.
what about everyday people?
Mhm. Exactly. Well, and I think another thing that was interesting that you and I talked about was really about marketing, and because you were asking me about my background and stuff, and I also left with some of our conversations, you talking about that the marketing machine that is out there is convincing people of what they need. but nobody's actually doing the true homework and foundation of what the person.
100%, because it takes time. It takes effort.
Mhm.
It takes effort, it takes time, and we are 30 seconds now. Now we're just in a 30-second zone where we need an answer in like 30 seconds to, you know, and most of the and this is where I want to revolutionize because I think we can. I think with with certain tools and with certain we can start a movement where we can demand this from our own from our own physicians, and physicians can learn a great basic model, and we can build on that. But the paradigm has to change.
Mhm.
There
Absolutely.
has to be a paradigm shift into realizing that we are human beings of multidimensional. We're not linear. And I'm going to give you an
No, you're
example.
speaking my language.
I'm going to give you an example, which I think is going to so align with everything that you and I have discussed when I was so excited
Yeah.
in our first
First conversation. Yeah.
conversation. Yeah. Okay, let's say you go to the doctor and you get weighed.
Mhm.
You've got your BMI, body mass index, and
Mhm.
you've got your height, weight, right? And body mass index. Let me throw a third dimension in there. Percent body fat.
Mhm.
Let's say you're a 200-pound guy and you're 40% body fat versus 20% body fat on a 200-pound guy.
Mhm.
That totally shifts your health, longevity, right?
Exactly.
So now there's your third dimension, right? Now let's even get into more dimensional just
Yeah.
on height, weight, and your physique.
Right. Yeah.
You have two kinds of fat, subcutaneous fat and visceral fat. So
Yes.
what if your visceral fat, the one that's going around the organs,
Mhm.
you have more visceral fat. So I have clients, ladies, and they're like really thin, but their visceral fat levels are like 13.
Wow.
How is that possible?
Mm.
So you see where, so this is why, and then so that's just one explanation, and we can spend hours and days and weeks just talking about body composition and visceral fat and subcu fat and what the implications of that is going to be.
Mhm.
And so leave that. Now, what about our ability to heal?
Yes.
Our ability to heal.
Yes. Everybody, and also everybody heals at different rates too. That's why it
Yes.
is an individuated thing when we
And what about the energy from our heart and
Mhm.
the energy of our brain? We have now neurons, so there is a field emerging. And
Mhm.
again, I don't know if people are aware of this. It's called neurocardiology.
I
My
want to
husband
on
was
that.
a most fabulous cardiologist, and I learned so much from him. And there was something known about a broken heart syndrome. He would go in, and the person had a heart attack, but he would go in, arteries were totally clean.
Mhm.
There was a broken heart.
Mhm. Yeah.
So we
Well, I
start to recognize, we've recognized that feelings and and our again, there's a heart and brain connection.
Mhm. Yes. Well, and I think those are all the things that we need to start recognizing in order to become whole, right? We can't just be looking in one in a monolane, right? As you just to start where we actually had started in the very beginning.
Yeah.
So if you were to say like where your practice and longevity is going to go in the next 5 years, what would you say?
Really want to know?
Yeah. Yeah.
You really
What'd you
want to know?
predict?
Okay, all right. I started, I told you with all the obstacles and everything into regen it's now called regenerative. We call it anti-aging.
Yeah.
So anti-aging medicine, right? And then people said that doesn't look right. So we get called it longevity, regenerative medicine, and so forth. But I started
And
20 years ago. Yeah.
there's no like the zero
Yeah.
threat.
So now I see the next is going to be amazing. And that's where I hope to take that journey and be still communicating with you and hopefully make that shift. Bioenergetic medicine, where
Amazing.
where I know right now we're in the sort of the quack field of it, but it's going to be where a certain mantra, a certain sound will get the vibration of the cells to heal. The
Mm,
nutrients, we're working, nutrients may have certain frequencies.
mm,
We may have certain modalities just to heal, certain ways that even objects can move with sound, even cells can heal with
with
not just
sound and
sound, but just other
vibration.
modalities.
Yeah.
It's learning about that we're energetic human
E-
beings and that we're going to need to have medicine has to step up to that game.
Mm,
Medicine has to step up to deal with, oh wow, what is the frequency? What is it? So right now we're learning about frequencies, but we they don't last long enough. Like a 528 frequency we do, but we don't know how much it really lasts in that person or what it really does. But how about if we're able to master these these frequencies and learn as an energetic human being what your energy is, what
mm,
your frequencies are.
mhm. I think it would be, I would love to be involved in that because I think I think there are reasons why people are attracted to different people and their vibration for sure. And you see it. And there's a reason why you can see, right? Is because you can sense the vibration of different people and what they might possibly need, right? So
Yes,
in their healing journey. But I think
absolutely.
that is, I do feel like we're like I don't know how many years, you probably know better than I do, like how long ago it all started. I mean, definitely at least 20 years ago, but it's becoming
Mhm.
more and more mainstream, but there's not enough data. Yeah. Right.
And we can't so again, data, let's go back to statistics. This is something that cannot go into a traditional, like a normal cause, like a double blind placebo. So you can't do you can't, the tools to do these studies have to change.
Mhm, absolutely. Yeah.
And so
The
that's
standards
why,
have to be raised in order to to formulate it so that it
yeah.
becomes like
Yeah.
acceptable,
Yeah,
right?
the mathematical models, the distributions, all these things that we're using to study, and all these traditional studies, like these clinical trials and all of that, they don't apply when we're wanting to go and introduce to this. This is a whole concept, and I have some, idea of distribution, some idea of AI technology we can utilize and so forth, but it's not going to be that same allopathic type model where we do the symptoms and we build, like I said, you make a diagnosis or disease, and then the pharma industry does this clinical trial or this double blind placebo or whatever study that they do, and then we get a drug, and then that's it. Just that whole system has to evolve. And I think that's where we're like evolving now,
As human species. Yes.
even as the human
Absolutely.
species.
Yeah, totally. I agree with you.
Yeah, yeah.
Well, I ask every person this when we end our interview, but what would you say your top five core values are, and how do you
My
use in your day-to-day life?
my five top core values, I would say I have to start the day with meditation and gratitude, and I have to thank, and I have to thank, and have to feel the love for the people, that are important to me. So that's very important. Second thing, eat well. I have to pay attention to what I'm eating, what I'm putting into my body, because that's very important. And if I'm bad, I'm not perfect. If I'm bad, then I need to know how to
Have
mitigate
any
it.
fun if you're perfect
Yeah,
all the time? Who wants
yeah.
to be perfect?
So I
Of
and
course.
I have to mitigate it. So I know how to mitigate. So learning that's very important to core. Third thing is to have a passion for what you do.
Mm,
That's the only way to keep going. I think without getting lazy or lackadaisical is
mhm.
to have the passion. And the most important thing that I do is I make sure that I over deliver and under promise by time is the best gift you can give to anybody. So in every day, if I can just give, whether it was a client that I just didn't even like they wanted me to talk and I didn't charge for that call, but I talked to them for like half hour, so be it. It was giving that time.
I have a
Time is the
feeling
most
that
valuable gift you can give.
absolutely. I have a feeling that you believe in like karma, like meaning in the way that what you put out comes back to you tenfold. Because what I see from you is you have so much heart, like you give so much of yourself. uh, to others, it is it's an amazing gift. And like you said, it's time, but it's also heart. It really is because it's like you're educating people at the same time as you're not just giving just pure, it's like presence, heart, education, and time all wrapped together.
Absolutely. And I will say one thing, when you recognize that, Michelle, in other people, and one, if I had to live my life, if I had to give advice to somebody who's coming to the level where I am at my age, I would say, when you're that giving, have discernment.
Mm-hmm. Thank you for saying
Have discernment.
hmm. Yeah, well, I have a feeling that you're talking to a mirror right now.
So
Uh,
I so look forward to is to having
yeah,
more meetings with you. But do you see where I'm
yes, I do.
when we come, uh, anyone that I have discernment.
Yes, absolutely. I 150% agree with you, and that's something that I had to learn as I
I
got older because I would just give. And
that's
so, um,
yes.
I hear you, and I respect that, and I will take that knowledge to the grave. So I just want to thank you for
Like,
your time.
absolutely.
And I want to also just say I'm so grateful that Dr. Naina will be doing an upfront as well as participating on the panel at the
Yes.
Soulful Wellness event on March 21st here in Santa Monica at Legendary
Yes.
Foods. And is there anything that you want to leave people with, like where to reach you? I know you're not big on Instagram or anything like that, but like if they should go to your website.
They can go to nainamd.com, nainamd.com, or I think we have Instagram. I think it's nainamd underscore Beverly Hills.
Okay,
So we do that, but yeah,
perfect.
or yeah,
And then just one last thing. If there was a legacy you wanted to leave to the world, what would that be?
it would be to have love, gratitude, and be thankful every day. But hear me out on this. The entire shift of our soul and this as we're ascending as human beings and so forth has been to take care of yourself, and we make mistakes and all that, but no one is telling us one thing. When we make mistakes, and we're humans, we make them
Yes.
every day, we have to repent and
Mm,
learn. That doesn't mean we were guilty. Learn and become a better person.
mm,
That's a legacy. We're never going to be perfect. Oh my God, we're going to mess up so many times. But if we don't learn and become a better person, and instead go around people and say, oh, just move on, and just forget how many people we might have caused pain to, that we're just supposed to forget.
mm,
No, we remember that pain that we might have caused, but
absolutely.
we become better people. And with that same love and that same passion to become better and to become more loving, more giving, and more thankful,
That's so
that's the
beautiful.
legacy.
Yeah, I love that because what you're saying resonates so highly for me because the word, like when we apologize, really it means I'm gonna do better. And that's what a true apology is. It's not just words. It actually means I will try harder. I will change the behavior. Yeah.
So maybe that's the legacy, is to really get to know the meaning of being sorry.
Mm,
And when we mess up, we just become better and better.
I love it. Well, that I want to share something with you. Do you realize nobody in the 152 calls that I've ever had for my podcast has given that great, great, great advice?
Thank
All
you. Thank you.
right.
Look forward to seeing you.
All right.
Really, it was a pleasure. It was a pleasure to be on your show.
I'm so grateful. I'm so grateful for you. Thank you so much for joining me today on the Opportunity Knocks podcast by Empower Purpose and me, Michelle Valenzuela Wolf. If opportunity is knocking at your door, feel free to take inspiration from the journeys of our diverse female entrepreneurs. Their tips and transparency are all available on the Opportunity Knocks podcast. Thank you for your support and subscribe now.